In Canada, alcohol use is a social and normalized event that creates an environment leading to alcohol abuse and negative health effects. The coming slides will relate this report to several major discussions on health as a way to analyze how they affect alcohol consumption in Canada.
Hi, I'm Veronica, and I'm going to be talking about the relationship between the 1974 Lalonde Report and the 2015 Alcohol Consumption in Canada Report. To begin, the Lalonde Report was the first government document to acknowledge that looking beyond traditional healthcare and the mechanistic model of health was needed. It discussed that political and economic forces are important to encourage healthcare policy initiatives, so essentially all levels of government should be actively involved in health promotion. The Lalonde Report discussed in general the responsibility of citizens on engaging in high-risk behaviors, whereas the Alcohol Report specifically focuses on raising awareness and the potential risks of drinking. The 2015 Alcohol Consumption Report greatly emphasizes that drinking alcohol serves a negative effect to an individual, but more importantly, it serves a great amount of harm to society. These risks include, but are not limited to, increased rate of premature death, disability and disease, a burdened healthcare system, and a high financial burden to both the individual and society. Overall, the Lalonde Report and the 2015 Alcohol Consumption Report both focus on health promotion and attempt to reduce self-imposed risk behaviors. The Lalonde Report brought about the EPS report and the Ottawa Charter for Health Promotion that will be later discussed in this presentation.
I'm Emma Grant presenting the Alma-Ata Declaration. In regard to the 2015 report of alcohol consumption in Canada, the Alma-Ata Declaration has some major connections to how the issue of alcohol use should be approached. It extends beyond the Lalonde report by broadening how lifestyle and environment affect health and acknowledges social determinants of health causing disease. The Alma-Ata Declaration emphasized primary health care as a way to improve health. Primary health care is a much more holistic view of health than what previously dominated the healthcare field, and increased the importance of reducing health inequalities, providing care based on needs, and increasing community involvement in health. In the 2015 report, it was apparent that the dangers of alcohol use and abuse need to be more widely understood, especially relating to pregnant women and alcohol, underage drinking, and the amount of alcohol that can be safely consumed. Community education is the key to having an increased understanding of the dangers of alcohol and ways to seek help. By having full community involvement, as suggested by the Alma-Ata Declaration, there's a much greater chance of having alcohol-reducing efforts be successful. Implementation of a primary health care model, as suggested by the Alma-Ata Declaration, creates a greater community awareness of health and provides people with the tools and knowledge to access care specific to what they need, increasing the health of all.
My name is Randall Tabone. So health is a complex topic with many different factors coming into play that equates to good or bad health. The same can be said of alcohol, as there are a number of reasons as to why people drink in excess, many of them socio-economic in nature. Instead of looking at the individual and his or her alcoholism, it would be better to look at lifestyle factors such as the environment as a better way to define the root cause to treat it. The 2015 report outlines this, as well as the ways in which the federal and provincial governments work together to reduce the dependency on alcohol through their implemented strategies and programs. It also encourages the sentiment expressed in the EP report that health, much like alcohol, is the result of a multitude of factors and should be looked at from a macroscopic view to assess the best ways to treat it. By encouraging all citizens to actively take part in the health of themselves as well as those around them, such as by recognizing the lifestyle and social factors that contribute to alcohol abuse, the health of all Canadians will greatly improve.
My name is Mihina Varturaso, and I'll be talking about how the Ottawa Charter for Health Promotion Strategies are seen in the 2015 Alcohol Report. The Ottawa Charter for Health Promotion was primarily a response to growing expectation for a new public health movement around the world. They include 5 broad strategies that promote healthy lifestyle and well-being. We can see these strategies in the 2015 report for alcohol. One of the strategies seen in the 2015 report is the Build Healthy Public Policy. The report explains in detail the risk of consuming too much alcohol and the effect it can bring to an individual's health, whether it's long-term or short-term. They are also promoting programs and guidelines such as Canada's Low-Risk Alcohol Drinking Guidelines, Canada's National Alcohol Strategy, and many more. Another example includes the Develop Personal Skills Strategy. This can be seen through the programs and campaigns that are meant to bring awareness about alcohol. It would also educate people and allow them to enhance and improve their health and well-being.
My name is Amelia and I will be talking about the Jakarta Declaration. As aforementioned in the Alma-Ata Declaration, an emphasis on health promotion and education were made. The difference in the Jakarta Declaration is it talks about social economic factors and mental illness. This is explained in the Public Health Report for Alcohol Consumption in 2015, where it mentions that people with a lower income or those who work longer hours and were more stressed were more likely to take part in risky drinking. The Jakarta Declaration was also the first to focus on mental health and acknowledge the need for global recognition. The report in 2015 suggested that some mental illnesses were the effects of heavy drinking, and there are links between anxiety disorders and alcohol use as well as depression with alcohol use. The Jakarta Declaration also identified social media access and other communication technologies to have significant impacts on health. In the 2015 alcohol report, it was mentioned that the social media allowed for alcohol to be socially accepted and is used in social events or celebrations, making risky drinking more prevalent. Overall, the Public Health Report on Alcohol Consumption in 2015 aligned with the Jakarta Declaration by touching on topics such as socioeconomic status, mental illness, and the use of social media and the effects of each one on one's health.
Hello, this is May. I'm going to talk about the Bangkok Charter for Health Promotion focused in the 5 actions to improving health and health promotion, and comparing that with the Chief Public Health Officer report about alcohol consumption in Canada. There are a lot of researches and facts about how can alcohol leads to many diseases for a long time, such as cancer, and for a short time in anxiety, and this is one of the 5 actions, which is build capacity for the Bangkok Charter that the Chief Public Officer Board uses.
Hello, my name is Victoria, and I will be talking about the Canada Health Act. The Canada Health Act focuses on the funding of our healthcare system. It lists criteria that health programs must follow in order to receive funding. Although the Canada Health Act is focused on funding and regulations, its overall primary objective is to protect, promote, and restore the physical and mental well-being of residents of Canada, and to facilitate reasonable access to health services without financial or other barriers. The 2015 summary stresses the issues that can arise from alcohol abuse in Canada, particularly amongst teenagers, and gives some resources in order to prevent alcohol abuse. The objective of the Canada Health Act aligns with many of these programs, as they also aim to restore the mental well-being of their patients. Also, the criteria listed in the Act matches the values of these programs. Values such as universality and accessibility are very important to these associations, as they aim to help as many people as they can, regardless of their financial situation.